Hi, welcome to Nursing Manthra English question practice. We will see cardiovascular system related question. The nurse is performing a cardiac assessment on a client. The nurse auscultates a loud blowing sound at the second intercostal space, right sternal border. How should the nurse document this finding? So there is loud blowing sound at second intercostal space at right sternal border. Option A, arterial bruit. Option B, murmur heard at the aortic area. Option C, pericardial friction rub. Option D, S3 gallop heard at the mitral area. The answer is murmur heard at the aortic area. So you can see in this picture aortic area, second intercostal space to the right sternal border. So the sound is there in the question. Okay, so angle of Lewis, then pulmonic area, second intercostal space to the left sternal border. Then Erb's point, that is the third intercostal space to the left sternal border. Tricuspid area, that is fifth intercostal space to the lower left sternal border, and mitral area in the apex. Okay, fifth intercostal space and MCL and all. So you can sometimes in the questions and NCLEX questions and all, they can ask to point out the these areas. So always keep this picture in your mind. So why I selected the answer murmurs? Murmurs are produced by turbulent blood flow across diseased or malformed cardiac valves. Turbulent blood flow across the diseased or malformed cardiac valves. That is murmurs. Murmurs can be characterized by musical sound, okay, musical, blowing, swooshing, or rasping sound heard between the normal heart sounds. The aortic area is located at the second intercostal space, right sternal border. So, in the question, they were asking regarding blowing sound. Here, murmurs will produce blowing or swooshing, musical sound or rasping sound will be there between the normal heart sounds. And aortic area in the picture you can see it is located in the second intercostal space on the right sternal border. Option A, that is an arterial bruit. Arterial bruit, the sound, it is like a turbulent blood flow sound heard in the peripheral artery, not in the like a cardiac valves malformation and all, not there. It is in the peripheral artery. If there is issues, there will be turbulent blood flow. That sound we are calling it as arterial bruit. And option 3, that is pericardial friction rub. Pericardial friction rub, that is high pitched scratchy sound, will be the scratching together. Okay, like leather to leather scratching. That sound, that is pericardial friction rub. Sound during S1 and S2 or apex of the heart. It is best heard with the client sitting and leaning forward and at the end of expiration. It occurs when inflamed surface of the heart rub against each other. That is pericardial friction rub sound. Option 4, S3 gallop sound. S3 gallop, that is an extra heart sound that occurs closely after S2. It is a low pitched sound heard in early diastole that is similar to the sound of a horse's gallop. The mitral area is located at the fifth intercostal space, medial to the mid-clavicular line. So, we selected the option that is murmurs. Murmurs indicate turbulent blood flow across the diseased or malformed cardiac valves. They are often described as musical or blowing or swooshing sound that occur between normal heart sounds. They may be auscultated at the aortic, pulmonic, tricuspid or mitral areas. Now we will discuss regarding ophthalmology, that is retinal detachment. A football player is brought to the emergency department after a helmet-to-helmet collision without loss of consciousness or signs of external trauma. Which clinical finding warrants immediate intervention? Option 1, hairnet-like effect across vision. Option 2, loss of memory about the collision. Option 3, temporal headache. Option 4, tongue laceration oozing blood. The answer is hairnet-like effect across vision. Why that option we have selected? Any blunt force trauma to the head is associated with potentially severe complications will be there. Brain damage, herniation, retinal detachment, seizures, these all are the complications for blunt force trauma of the head. So always when you are getting a head injury patient, you have to check for brain damage, herniation, retinal detachment, seizures, etc. Prompt recognition of potential complication is essential to prevent irreversible changes to the client's neurological status and level of function. So here, retinal detachment. What is retinal detachment? Separation of the retina from the posterior wall of the eye. That may occur following the head trauma. You can see in this picture. Retina is getting detached from the posterior wall. This is an ocular emergency as it will lead to the permanent blindness, may result without intervention. If we are not doing any intervention for this, it will lead to the blindness. That's why it is an ocular emergency. What are the signs of retinal detachment? Signs of retinal detachment include perception of lightning flashes. The flashes of light will be there. They can see the flashes of light or floaters will be there. Sometimes curtain like shadow, something is coming like a curtain is falling down like that, they can find. Or gnats. Gnats is a is an sorry. Gnats is an insect. Sorry, gnats is an insect. Then hairnet, like they will see like hairnet or cobweb. That effect will be there throughout their visual field. That's why it is an important option we have to select. It is an emergency. That's why we have selected the option 1 as correct. Now we will go through the another incorrect options why we didn't select. Option 2, loss of memory. Normally, after an accident, loss of memory about the accident or a retrograde amnesia is common. That is commonly reported after mild head injuries. The client should be monitored for decreased level of consciousness or any alteration in the mental status, which may indicate intracranial bleeding. We can monitor the client for that. Option 3, that is headache, temporal headache is expected after mild head injury and is not innately concerning except if the pain acutely worsened or it is not relieved by over-the-counter analgesics like acetaminophen, ibuprofen and all. Option 4, A bleeding tongue laceration may occur when the force of the trauma that caused the client to accidentally, the client will bite the tongue. Oozing blood, although disturbing to the client, does not pose an immediate threat. But immediate threat is always the retinal detachment. So, retinal detachment, that is a separation of the retina from the posterior wall of the eye, and that may result from blunt force trauma. If not, if not promptly recognized and treated, permanent blindness may occur. Signs of detachment include lightning flashes or floaters, curtain-like gnats, hairnet, cobweb effect throughout the field of vision. I hope you understood regarding the retinal detachment and the why we selected that option for this question.
Introducing the all-new Nursing Manthra NCLEX series, which contains question bank, which is including the new generation NCLEX question. Rationale followed by each question helps you to understand the question. The explanatory video collections with the help of illustrations and animation. Exam handbook, mock test and cheat sheets. Select your package now and get started. For more information about the subscription plans, you can contact Nursing Manthra WhatsApp.